All right, so you're interested in dental abscesses. Ouch, right. I mean, we've all been there, that dull ache that turns into, I need to see a dentist, like yesterday.
Yeah, and the thing about that pain is, it's not something to ignore. It's your body trying to tell you something's wrong.
And we're talking about dental abscesses today, which, let's be real, it's more than just a toothache, right? This is serious business. We're talking infection.
Absolutely. And the consequences of ignoring an abscess, well, they can be pretty severe.
Like what Dr. Lilly was saying.
Dr. Lilly's research was pretty eye-opening. He found that even waiting just a week to address an abscess increases the risk of needing a root canal by 40%.
40%.
40%, which really highlights the importance of catching this early. In some extreme cases, if left untreated, it can even be fatal.
Fatal. Wow. Okay, so this isn't just about saving a tooth. We're talking about overall health here. No wonder you've been researching all the different types of abscesses.
Right, because understanding the different types can help us understand the risks associated with each, and why ignoring any tooth pain is, well, a bad idea.
Exactly. So let's break it down. We've got three main culprits, right? Starting with, let's see, the gingival abscess.
Hmm.
That's kind of like the first line of defense being breached, right? Like imagine your gums are the walls of a castle.
And this is like somebody snuck in through the back door.
Exactly. Now, moving on to the periodontal abscess. This one's a bit sneakier, isn't it?
It is. It likes to set up shop deeper down, affecting the things that support our teeth, like the ligaments and bone,
Mhm.
the foundation, really.
And then we've got the one that everyone dreads, the one that seems to cause the most trouble, the periapical abscess.
Yeah, that's the one that gets right into the heart of the matter, literally. It takes hold within the tooth itself, affecting the pulp, and that's where things can get really nasty.
And when we say nasty, we mean painful.
Hmm.
So how would someone even know if they have one of these unwelcome guests camping out in their mouth? What are we looking for?
Well, I think the most obvious sign is going to be pain. And I mean serious pain. Throbbing, constant, the kind of pain that makes you want to crawl under a rock and hide.
Definitely not the kind of pain you could just ignore.
Exactly. You might also experience swelling around the affected area, like your gums might be swollen, or even your face. And bad breath, like really bad breath, is another giveaway.
The kind of bad breath that could knock someone over.
Exactly. And sometimes you might even notice a weird taste in your mouth or even see some discharge if the abscess has started to drain.
Oh, that's pretty unpleasant. But, as much as we don't want to think about all those symptoms, what I find really interesting is what's actually happening inside our bodies when this is all going on. What's causing all of this?
It's actually pretty fascinating. All those awful symptoms we talked about, they're not the infection itself, they're signs of your body fighting back. Take the pain, for example. That's actually caused by pressure building up from pus as your body tries to isolate the infection.
So the pain is a side effect of our immune system doing its job.
Exactly. And the swelling, that's your body sending white blood cells, the good guys, to the site of the infection to fight it off. It's like sending in the cavalry, except, on a microscopic level.
So our bodies are waging a microscopic war against these abscesses. Pretty wild, right? But even though our bodies are putting up a good fight, it's still so important to remember that professional help is crucial. This isn't something you want to try to tough out at home.
100%. Home remedies might temporarily mask the symptoms, but they won't address the root cause of the problem. We need a dentist for that.
Exactly. And the longer you wait,
Yeah.
the worse it can get. So to sum it up, if you're experiencing any of these symptoms, don't wait. Get to a dentist ASAP.
Absolutely. And, thinking about the potential consequences of these abscesses, it makes you wonder, what advancements in dental care will we see down the line? What's going to change in the future to combat these things even better?
That's a great question, and one we'll have to save for another deep dive. But for now, thanks for joining us. We hope you learned something new and feel empowered to take care of your amazing smiles.